Hello everyone, I am Nafisha Parveen and today we will know about eating disorders. Majority of young boys and girls are dissatisfied with their body weights as well as their physical appearance. Boys in general want to be taller and want to have more muscular bodies, which is a healthy trend. But in the case of girls, the girls view themselves as fat and want slim body figure to look slimmer, the so-called Aishwarya Rai syndrome. Sometimes the obsession with body weight may be so severe that it leads to eating disorders like anorexia nervosa and bulimia nervosa. These are psychiatric disorders and primarily affecting adolescent girls or young women who had been previously healthy but start developing an intense fear of becoming fat or gaining weight. First, here is anorexia nervosa. Anorexia nervosa is an eating disorder which is characterized by an abnormally low body weight, an intense fear of gaining weight, and a distorted perception of weight. To prevent weight gain or to continue losing weight, people with anorexia usually severely restrict the amount of food they eat. They may control calorie intake by vomiting after eating or by misusing laxatives, dietets, and diuretics. Symptoms of anorexia nervosa are restricted eating, extreme thinness, which is called emaciation, inability to maintain a normal body weight, fear of gaining weight, distorted body image, a self esteem that is heavily influenced by perceptions of body weight and shape. Other symptoms of anorexia nervosa are thinning of the bones, mild anemia and muscle wasting, weakness, brittle hair and nails, dry skin, and skin is covered with fine hairs, which is called lanugo, constipation, low blood pressure, feeling cold, insomnia, infertility, and others. Next, here is bulimia nervosa. Bulimia nervosa is a condition that occurs most commonly in adolescent females, which is characterized by indulgence in binge eating and inappropriate compensatory behaviors to prevent weight gain. Symptoms of bulimia nervosa are being preoccupied with body shape and weight, fear of gaining weight, eating a large amounts of food, feeling a loss of control during binging, forcing to vomit or exercising, using laxatives, diuretics, fasting, avoiding certain foods between binges, using dietary supplements or herbal products excessively for weight loss, menstrual irregularities, and others. Next, here is binge eating disorders. Binge eating disorder is described as the intake of lots of food in a short time. Binge eating episodes characterized by uncontrollable and painful consumption of large amounts of palatable food are the cardinal features of binge eating disorder. This is also very common in obesity and type 2 diabetes mellitus patients and is often associated with higher body mass index or higher BMI. Symptoms of binge eating disorder are eating large amounts of food in a specific time, feeling that eating behavior is out of control, eats even when they are not really hungry, eating rapidly, eating until uncomfortably full, eating alone or in secret, feeling depressed, ashamed, guilty about eating, frequently dieting. Here are main difference of these three disorders. In the case of anorexia nervosa, restrict eating or intake low amount of food. In the case of bulimia nervosa, binge eating is there and followed by compulsive purging. And in the case of binge eating disorder, binge eating is there and typically no purging afterwards. These eating disorders are mental health conditions and this can lead to severe nutritional deficiencies. Early intervention is very important in treating eating disorders as the longer an individual goes without treatment, more difficult it can be. to achieve full recovery. So here we done the topic eating disorder. Thank you.